It's great to welcome to the program today David Liss, who is a health services researcher at Northwestern University. He conducts research to improve the quality and value of primary care delivery. David, it's great having you on today.
Thanks for having me.
So, in the context of Obamacare, but also more generally, there's the discussion of preventive healthcare, the idea that it's cheaper to prevent or treat something early than it is to wait until it becomes more serious. I think that intuitively makes sense to a lot of people. But that can take sort of a lot of different forms and shapes. One can be you go into the doctor every year and they feel around, listen to your lungs, etc. That could include doing regular blood work, cholesterol, complete blood count, etc. Then there's also other types of screenings, starting to do PSA and prostate exams for men at certain ages, colonoscopies, mammograms, etc. So there's all this different stuff. How can we start to kind of categorize these things and think about the impact on people's health from them?
Well, I think, at least what we do here in the research world or in the sort of medical care world is that there's an organization called the U.S. Preventive Services Task Force, and that's been around for a while. But what the Affordable Care Act did is that it took services that are recommended by this group, the USPSTF, as we call it, and services that are recommended by this group are now fully covered under pretty much all or certainly most insurance plans that people have. So we're talking about some of the things you mentioned there, things like colonoscopies and colorectal cancer screening, mammography for women aged 50 to 74, recommended vaccinations, et cetera. So there are many services that have been shown there's clear benefit. They can help people live longer and healthier lives. And there's been this group of researchers who has really sifted through the data, continues to pour through it every few years, and they find that these are beneficial services. Other things like prostate cancer screening that I think you may have mentioned, PSA tests, even these kind of routine lab tests, a lot of those services aren't actually recommended to be done regularly. Maybe for some high risk patients, but for your average or low risk patients, some of those services are not recommended by this group and aren't necessarily covered for free through your insurance plans.
Yeah, so there's this idea of what is it that we're trying to do, like with a general health check, and one answer would be, well, we're trying to diagnose something earlier in order to control it. And then a
Absolutely.
subsequent question, I guess, would be, okay, if we do that, are we improving quality of life or extending life? And I guess the answer is not always yes. It kind of depends what we're doing, right?
It depends, yes. Again, there are a lot of kinds of screenings we can do, a lot of kinds of risk factor checks that can be done, where, again, if you catch it early and there are available, well known treatments, you can certainly be extending life and quality of life. Now, the problem there is that if you're doing things that aren't necessarily recommended, maybe that could fall in the range of things like PSA tests, could be things like routine labs. There's a potential for a lot of these false positives, as you will. Maybe the test finds something and it's potentially worrisome, and it leads to this sort of cascade of testing, lots of worry on the part of the patient, additional testing, and sometimes all for no reasons, sometimes for a false positive, mammography that happens sometimes. So what we try to do sort of in the research world and the medical world is find a balance between as we've heard, I think sometimes when we think about the vaccination debate for COVID, where do the potential benefits outweigh the potential harms? And again, there are several services, certainly colorectal cancer screening being one, where the potential benefits certainly clearly outweigh the potential harms.
One of the things I read, and I'd be interested in hearing what your research has shown or your take on it, is that a lot of the things that are done that are kind of in the under the cardiovascular umbrella don't seem to actually reduce an individual's chance of having a heart attack. What is can you talk about that a little bit? Is that true? What does it even mean to say that?
Well, what I certainly can say is that some of the bread and butter things we think about most stereotypically, checking your blood pressure. It
Mm.
obviously happens at all of our doctor's visits. That's perhaps the most, or certainly one of the most important things that can happen in terms of helping people identify a health problem and getting it under control. We have many, highly effective, inexpensive treatments that can help prevent heart attack, stroke, death, et cetera. Some of these other, maybe more exotic kind of tests, again, doing a lot of digging, doing a lot of tests that aren't necessarily recommended. Again, that's where we're talking about the potential harm could outweigh the potential benefit.
When we talk about the annual physical for a second, and we have the parts which are a discussion where you might mention symptoms or answer lifestyle questions, and then you have the physical exam, which depending on one's age varies, and then you have here are the blood tests or other things that I want you to do. Everything but the physical exam could be done virtually. What do we
Much
know
research,
about
certainly, yeah.
what do we know about the importance of the part that's happening in person with the annual physical versus the other? And of course, once you're at a certain age and there's a prostate check, that obviously cannot be done virtually.
So you're right. A lot of these sort of elements of these visits could be done virtually. What I would also say is that what some of our research has shown, research really clearly shows, is that the physical exam, a comprehensive physical, is not necessary. What has been shown to be clearly effective, and I think you alluded to there, is we're talking about lots of screenings, lots of risk factor checks. And again, as you said, a lot of that could be done virtually, could be done even on, kind of sometimes via a questionnaire on your computer. Things like screening for depression, screening for problem drinking, screening for smoking or tobacco use. So much of this, these kinds of screenings can be done virtually. What's interesting, what we'd like to learn is what can be done really well virtually. What are some good models to do that virtually? Certainly there's a lot of work that can be done, but let's say you do find a patient is depressed. Now, if you've done that screening virtually, how can you connect with them and get them in to get recommended care? Or things like blood pressure screenings. If someone's experienced at it, certainly they could be doing it if they have one of these blood pressure cuffs that could be used at home. That said, it's not always so simple, and I think it'll be really interesting to see what are the balance. What can we clearly find that can be done well consistently at home or virtually versus what things need to be done in office, and how do we sort of get that sort of division of labor worked out?
One of the things that seems like it might make it more difficult to ascertain sort of health outcomes and health status might be that people who do the annual physicals may be folks that are already more likely to maybe make healthier lifestyle choices or maybe eat a better diet or whatever the case may be. Is it possible to separate that out to really talk about the impact just of the physical and the screenings?
So there's I think maybe a couple things you mentioned there. Let me again go back and say these physical exams themselves, we don't really need these comprehensive physical exams.
Yeah.
But as you touch on as well, these visits, these checkups, as I like to call them, oftentimes what we find is the people who are most likely to get these checkup visits are people who have gotten them previously, maybe a year. For that group, we found the potential benefit isn't as great as people who might be sort of from higher risk groups. And for those folks who aren't necessarily as motivated, I would certainly encourage them to sort of think about getting one of these checkups. But from the perspective of a healthcare system or a health system, that's where we need to do a little bit better work in terms of identifying those patients and finding ways to get them in, finding ways to help them understand the need to come in and the benefits for coming in, or if it doesn't involve coming in, doing some sort of a virtual screening, meeting them where they are and doing one of these checkups, because that's where really checkup visits we think have the most value. People who haven't necessarily been well connected with the doctor, who might be overdue for preventive services, whether that's cancer screenings, vaccinations, et cetera.
It's often mentioned that there are people who believe that the reason that a lot of these things are suggested, et cetera, is a desire from medical practitioners to avoid lawsuits, to say, hey, listen, I did my part. I did everything I'm supposed to do. We're going to add stuff. And the more stuff we add, the more likely it is I can say I didn't commit malpractice. I did everything I was supposed to do. In your experience, how valid is that concern or that assertion about the entire preventive care world?
Certainly not. I would say certainly not agree with that as it relates to the entire preventive care world.
Okay.
As we spoke about a couple minutes ago, when we talk about for what most insurance plans are going to cover with zero copay for patients
Hmm.
as a result of the Affordable Care Act, we're talking about these high value recommended services that have been screened and are reviewed every few years by this panel of experts. And these are shown to be consistently high value services. Now that's there's that we need to strike that balance. We don't want to, I come out and I say we want people to come in for checkups and get some of these recommended high value services. Where it's good is that, again, they're covered with zero copay. Most people are not going to have to spend a dime to be getting these services at their checkups, their cancer screenings, their vaccinations, screening for depression, et cetera. Some of those lower value services, some of the things that people, as you mentioned, might be sort of more skeptical of, I think some of those things there is reasonable skepticism, and some of those things the experts have shown there isn't good value to those. But for the typical checkup covered by your typical insurance company, we're talking about high value services that have been shown to be effective and again aren't going to cost people money to be receiving them.
Related to this, and I don't know if you can say anything about this at all, and if not, that's fine. When we talk about the dental cleaning, and now we're talking about dental health, number one, there's research into the connection between dental health and general health, which seems to be pretty compelling. And number two, it seems that in that case, we're really talking about something with very specific benefits. Where in all of this does the dental cleaning every 6 months and with or without x-rays, which I know is a big source of controversy for some?
Yeah, I don't have much expertise there, so and my research doesn't really focus on dental cleaning that much. But as you said, I've heard that there's a lot of research showing that dental cleanings are associated, I believe, with good kind of cardiovascular and heart health outcomes, which is quite interesting. Probably relates to some issues as it deals with things like inflammation in the body.
Right.
But also maybe it speaks to the fact a little bit of how sort of siloed sometimes healthcare is in the United States, and that a lot of us health insurance coverage is separate from dental coverage, and those aren't maybe necessarily as sort of harmonized or as comprehensive as they should be in the dental care area. But again, regular checkups I know is something that is recommended for dental care and has been shown to be associated with good overall health outcomes.
Very, very interesting. We've been speaking with David Liss, who's a health services researcher at Northwestern University. He conducts research to improve the quality and value of primary care delivery. Really appreciate your time and sharing your insights, David.
Thank you. It's a pleasure.